This is Dr. Charles Parker, and you're listening to Core Brain Journal. It's a place where I connect both fresh discoveries and interesting different perspectives from advanced mind science with the realities of real people and everyday life down on Main Street. Well, welcome aboard, folks. Here we are, Dr. Charles Parker, one more time at Core Brain Journal. And we have an interesting transformational guest today with us, an MD who faced bipolar illness, was really medicated and lost, and found himself in some interesting ways that we're going to hear about. So Dr. Jeffrey Fidel is joining us from Boynton Beach, Florida. Welcome aboard, Jeff.
Thank you, Dr. Parker.
Jeff, please call me Chuck. You're Jeff, I'm Chuck. That's the way we're going to do this. It'll be much easier.
Okay.
And so what I'm going to do is read your bio a little bit, and then we're going to hear more about you personally, and we'll go from there. So Jeff Fidel is, as we said, living in Florida. He refuses to live his life medicated for bipolar I disorder. In near complete solitude, he endured nearly a full year of intense mental anguish before really turning himself around. He was utilized mainly the ancient teachings of Lao Tzu's Tao Te Ching. He learned how to connect to a voice originating from his heart, from within himself. The voice within teaches him that our true identity is beyond thought, beyond thinking, and that I can read this clearly, we and the universe are really one. And so his book has a title in that direction. We'll talk about it in a second. So Dr. Fidel is now sharing these ancient teachings to help others and our listeners here discover their own answer inside. And his book in that regard is One MD's Inward Journey to Liberate Himself from Mental Suffering, and the help it offers to those diagnosed with bipolar mental illness or depression. And through his website and content and his speaking appearances, he pitches in to do even more than that. So with that intro, Jeff, a little broken up, I'm sorry about that. But what we want to do is hear a little more about you personally, if you don't mind.
Sure. Well, I grew up in Great Neck, New York, and I had a pretty typical upbringing. I went to high school like any other kid, and then I went off to college. I went to Brandeis, and then after that, I went to medical school at Tulane. Did a residency in diagnostic radiology. Practiced for 15 years, and so pretty much about as Western as you get. Lived the American life. I was married and had 2 dogs, and I have a 8-year-old son, and pretty much everything was going very well until about a year and a half ago, when I lost my marriage and my dog, and then I voluntarily walked away from my job as a physician, and then I threw my medicines away. And it was basically just me at that point. And that the last year and a half has been the turning point in my entire life. Pretty much when my life collapsed around me, I had to rediscover myself. And I did it in solitude.
Well, Jeff, you are so, from my, pardon my French, psychiatric perspective, but just as an experience of talking with other people in trouble and having had troubles, you're really more fresh out of the box than I thought you were when I was reading your bio. It's all relatively contemporary. All these things that happened to you with your dog and your marriage and finishing the medications. How did you actually take that first step into self-discovery from the pain you were in?
Well, I took a very, very large risk here. I didn't know how large of a risk it was because when I did throw out these bipolar meds, what I didn't realize was that my mind was going to take me on a ride of suffering, which I never could have imagined when I threw them away. And this was the whole danger, and this is the unique experience that I could only know now after have gone through all these states of mind that I endured, which were very scary states of mind. So in this year of isolation, I experienced visual hallucinations, auditory hallucinations, all kinds of very scary things that happened to me, all in my mind, of course. And then I was very fortunate enough to run into these teachings of the Tao Te Ching, which basically is a guide to learn ourselves beyond our thinking mind. And this is something that I had never known about, and it was very lucky that I reached into this book, because I went into states of mind that I endured for months, but luckily I never acted on any of the things that I was thinking of doing to myself, and I lived in these states for a long time. So, you know, this book is very dear to me because it enabled me to learn myself beyond my mind.
Well, you know, Jeff, I'm familiar with the book and read it long ago myself. And really, as I was reading your story, I was thinking about how similar we are in certain respects, having been down the same path to a certain degree. I mean, you're way ahead of me just with the amount of effort that you put into it. But the issue that I think is really transformational about this is that you were able to do this pretty much by yourself in a book. Now, we have to take a quick disclaimer here that we don't want anybody listening to this go out and say, you know, we're not really directing anybody, and you made this very clear in the introduction in your book. You and I are not directing as medical professionals people to go out and stop your meds and take a walk. We are strongly recommending that we look more deeply into the options that are available for a person who feels lost. And this is an option. This isn't a recommendation because we don't know each listener out there. We're just talking as two individuals thinking about options that may or may not be helpful to other people down the road.
No, this is very true. This is true because, like I said, only now can I tell this story. You know, I'm very fortunate. I consider myself almost like a someone that when you know, they didn't know if the earth was flat. It's only now that I know that I could have gotten back around because I didn't know when I'm in the states of mind, and this is the danger of it. This is why, like you say, it can't just be recommended people actually try this, because when I was in these states of mind, or when anyone's in these states of mind, they truly believe that to be their reality. So these states of mind are extremely scary. I think we read about them every day. People that are having spiritual crises, they call a spiritual crises hotline, or any states of minds that are labeled as schizophrenia. Some of these states of mind are so very scary that people have to be institutionalized. And that would have been me had I not just gone through months of that type of mental torment. And that the only way I could now know myself beyond thought was because of the teachings of the Tao. If not for the book, I wouldn't have been able to connect to this other part that, you know, this other voice within me that comes from my heart, and to accept that voice as my teacher. And that was the faith that I had within myself.
So help us and help me, because be honest with you, I've been a practicing mind doctor for 45 years and have never heard a story like yours, that you had this transformational experience, had a spiritual awakening, and put everything aside and pulled yourself together. Now, people I may have known may have done it, but I haven't had anybody tell me about it directly, so I'm absolutely interested to hear what happened, because from my biologics perspective, I wonder what else changed that contributed to your wellness, your diet, you obviously were less stimulated. As a diagnostic radiologist, you were obviously very stimulated, so there were certain measures of reality that were different for you. But what else happened to you during that year that helped you, besides the readings? Did you do anything different with your life besides go into solitude?
Well, what I had to do over time was unlearn myself. And this was the hardest thing for me to do, because what I did was everything that I thought I knew about myself, I kind of slowly surrendered over the year. In other words, my whole life I knew myself as my name, Jeffrey Fidel, my religion, my parents, and everything else that was acquired. You know, after I was born, I acquired all this knowledge. I wasn't born with knowing my name or knowing who my parents were or any of this. So the year was actually unlearning all of that entirely. And then, which was much harder than learning, by the way. Unlearning is very hard, because when we learn something, especially as physicians, I spent my whole life learning facts and knowledge. And like you said before, these are the dualistic things, the labels of, so it's unlabeling and unlearning everything, including myself, which was very hard to do, because I had to then learn myself beyond any words or mind constructs. And this is what I did in isolation. And then what I ended up doing, when I quieted my mind enough and there were no more words involved, I could then start to really feel the essence of who I was. In other words, subconsciously, I was protecting my heart and different parts deep within me from getting hurt. You know, I was crushed when I lost my first girlfriend. I didn't want to get heartbroken again. So to go back in and actually start to feel these things were very scary for me. But that was a large part of my meditations, was just allowing myself to feel, without putting any words to it, the actual sensations throughout my being, or you know, the essence of my body beyond my mind.
So you would actually, were you meditating? Were you doing extensive meditation during this period of time?
Oh, yes. This was like months of just solitude, meditations, very, very deep states, in complete isolation. And the danger was, and luckily it never happened for me, if I ever had told some people the states of mind that I was experiencing, or if I had gone back to a psychiatrist, and I almost did a couple of times, I didn't know how much longer I can do it. They would have been very scared of what I was going to tell them, because the states of mind I went through were, you know, complete, what would be labeled insanity. So it was very fortunate I didn't break down. And there was several times I didn't know if I can still go on, because I went on these states for months, but I just kept going on, and then there was an out.
Well, Jeff, we have a very informed audience here. People that listen to our programs tend to be up on the edge, thinking about things just as you are: meditation, guided imagery, alternatives to straight medications. Yes, we do want to use medications if people use them correctly, but really a lot of what we talk about at Core Brain Journal is this whole other side of thinking about things, why it's so apropos for us to be talking to you. So our audience is an educated group that may be asking themselves the question, this is interesting, but he still hasn't told us how he did it. And because a number of our listeners practice meditation, they have different practices that they do. Did you have a structured meditation practice that you adhered to, or what actually, how did you reach, was there a technique? I'm trying to get down to what you might have done that would have been supportive and helpful for you from a technique point of view.
There was no firm technique, because when I did it, it's kind of being like an explorer. this is why it was very dangerous what I did. You know, this is why I'm not recommending that people do this, but the only reason I was able to accept this voice within myself was because I had no other alternative. In other words, I got to the point where the voices of suicide were just overwhelming, and then I had two voices within me that were competing with each other, and I didn't know what to do. So to go through this state for months, and this is why I consider myself an explorer in this endeavor, was not a pleasant experience by any means. So to say that I have a technique, my only technique for people would just be what I can learn, what I could teach them in a safe way. And a lot of the teachings that I utilized was, for example, to forgive within myself. This was huge because a lot of what was happening was I was holding in stuff that I hadn't forgiven since I was a child. And by actually forgiving the person that I perceived in my mind to have wronged me, that was a great liberation within myself of releasing this anger. And then I forgave myself. And then I allowed myself to feel like, again, which I was very afraid to feel throughout my entire life. I was very, I was taught, like, or at least I perceived in my mind that it wasn't okay to cry, that I had to be a man all the time. So I really allowed myself to enter these states. But in doing so, even though I didn't have a technique at the time, from what I learned, I did learn a lot. And I think I can offer people a more safe way to start exploring themselves and not have to go through. It's my hope that they won't go through the torment that I had to go through, and somehow that they can start to connect within themselves on a deeper level. That's kind of like what my teachings are going to be, because when I did it, I did not have any way of knowing how to do it. And in fact, I went way too far. I was above my head. And what I literally, my mind was creating such torture that, but this is the power of the mind. And we can see it every night when we go to bed, what the mind can create. All kinds of visual movies, so to say. So the best I could say is I was living a nightmare in both the dream and in the awake state, and it was all in my mind. And only now can I know that it was all in my mind.
So
and
you were, technically speaking, you were underwater for a long period of time.
Oh yes.
So then let me ask you.
This was over a year, and some of the most, even the physical withdrawal. I was medicated for 25 years. So even getting off those meds, the sensations inside of my head, it felt at times I was giving childbirth in my head. But I just used that as my meditation. I just allowed the sensations to go without. This is where I was just for days in bed, just lying there and feeling what was going on inside of my head.
Well, to take this now, moving down the path, I mean, we're joining with you in this painful moment, painful months, painful year. But then the next thing, you did hint a little bit about a door that slowly swung open there, just in your conversation here with me, was that you really have some a grid. You have some structure that you are putting together because you want to share this experience with people in some understandable, structured way. Is that correct?
Yes, that's correct. It's my wish to help people. Having gone through all these states of mind, I could empathize with those millions of people that are suffering immensely. Many of it's just it's the creation of their own minds. They are taken away in their states of mind, and they're suffering. So it's my goal to reach out to these people and almost serve as like a liaison between the clinician and the patients, having not only being a physician myself and being very versed in neuroanatomy was actually my strong point, and neuroscience. I'm very versed in the sciences, but also because I've gone through the states of mind myself, so I feel that I could serve a little bit more as a bridge between the clinician and those that are suffering mentally, having experienced immense mental suffering myself.
Well, I am hearing a sigh of relief from our listeners, especially the medical practitioners, because what Dr. Fidel is saying is we need to work together with this. We're really not recommending everybody go off in the woods and smoke Genja or something like that. What we're really saying is that there are ways that a person can reconfigure themselves, thinking about it from a different, more transcendent perspective in terms of their entire life and the larger order of things. And that's really what the Tao Te Ching is talking about, is the larger order, so that you can actually get in the larger order and then thereby accept certain things and diminish the significance of certain things when you enter that larger order. Is that a correct overview?
Yeah, I think that the mind is certainly a large component of where we are as human beings, but I think also to introduce, and this is, I guess, something that I want to introduce to Western science, which is very thought orientated, is to start to go beyond thought, meaning to introduce the concepts of just feeling things inside of a patient in and of itself is healing, because there's a lot of subconscious protection going on. Even if a patient's speaking to a doctor, they might not tell the doctor everything that's going on, because there's a very subtle subconscious fear of whatever might be inside. This is why it's hard to get information out of patients in the first place. There's very subconscious things working here. So we do our best as clinicians to listen to patients, and then we act a lot of we're acting according to our belief systems, and we hear their stories, and then we say, okay, based on that person's story that they told me, and based upon what I know, I'll treat them in this way. That's a lot of Western medicine, is because we could only know from them what they tell us. We can't read their minds. So there's a lot of subconscious going on. So for the patient to start to want to feel inside of themselves, I think there's tremendous healing in that. And that means to start experience the actual sensations. Mm-hmm. Not even just talk about it, but actually go to the heartbreak. If they're talking about how they got divorced, to actually allow themselves to feel what they might be afraid of feeling, meaning their heart maybe, or the discomfort that they might be feeling, to just feel that actually there's healing in just that, without even speaking about it, to just sit there and feel it. There is a tremendous amount of healing in that.
Well, you master the pain. You actually realize that you're not going to die with it, and that you can actually get past it. And but
that's exactly right.
Yeah.
It doesn't kill you. Sitting with it doesn't hurt you. The mind might say that it's scary because it doesn't want to go there, but when you actually go there, nothing happens to you. You're just kind of like, wow, that's I never felt that before.
Well, that's so really helpful for you to talk about, Jeff, because what happens so often in modern psychiatry, even I'm finished training in psychoanalysis. Even in psychoanalysis, there are grids that are operational. There's no question about it. But one of the disheartening grids that people live with, which I'm sure you were involved with, having had the diagnosis of bipolar, and then bipolar 1 on top of it, I mean, whatever that is, it's a manifestation of your appearance from the outside. And it may have some indication of what you're actually thinking about, but it's still a superficial assessment of who you are as a person. It winds up being a label that then throws you into a box that people do certain things with that box. And the standard of care right now, if the person fits in that box based on how they look, then it's a medication fandango.
Yeah, well, that's the danger of science is a useful tool, and I'm not going to deny that by any means. Science has done some incredible things, but when we start to break human beings down into science and consider them just as labels, or that there's chemical imbalances, and we don't look beyond the humanity of the whole thing, we could run into some serious dangers. So we have to start looking at, look, these people, they're human beings. They're not just, it's not like you could just add a little bit of chemistry to it and fix it. There are some very deep issues that go way back to, they could be as young as 3 or 4. I think we all can recall in our minds things that have happened to us. We share that as a human being. So this is the danger of labeling, like you say. We're human beings in the end, and we need to treat each other as such, no matter what states of mind. Because beyond the mind, all humans are the same. We might believe we're different than one another, but when the belief systems are shut down, we look around and look, we're very similar forms. This is what we share as human beings, and that's a beautiful thing.
It is so, and let me ask you this, because of course I don't have you on the video here on the Skype, but I could see your picture. You look like a very healthy young guy. I mean, you're younger than I am, let's put it that way. So that makes you that makes you young, according to me. But you look great. And what I'm wondering is, I think others are beginning to say, hey, this guy's making some sense. How does he maintain? What is he doing now? What's his diet like? What does he do that keeps him in the groove, on the track, going down the road?
Well, I just listen to my body, really.
In what sense? How do you mean that? When you say that, what's the transfer,
okay.
the application of that?
Sure. Well, I kind of know when I eat properly and when I don't. So I think we all do as well. This is why we're all our greatest teachers. So I kind of cut out all the bad food that I eat, meaning food with preservatives in it, high fructose corn syrup, sugars, anything that raises, causes insulin spikes and whatnot.
Yeah.
And I just, I became a vegetarian because
there you go.
mostly even for ethical purposes, I don't believe in the killing of any, I used to be the largest meat eater you'd ever see, but since this, I don't believe that any conscious animal should be slaughtered. And I think actually a lot of people, if they went to a slaughterhouse, would actually stop eating meat. I hope no one from the meat industry is listening to this.
No, but, we're not going to worry about that.
My mom, she loves meat, but I'm like, Ma, trust me, if you saw an animal slaughtered, I don't think you'd eat your steak again.
Well, right so there just to interrupt you real quickly, because I'm so much with you on that point, Jeff. I mean, I'm not a vegetarian myself, but I'm going in that direction. I mean, I'm close to it. I'm working in that direction because I've had my own medical problems, which I won't bore you with. But the bottom line is Michael Greger, called How Not to Die, has a book. Have you read his book?
No.
You would love it.
How Not to Die?
He's an MD. He's got nutritional people, 5 or 6 layers deep, bringing in all the research from all over the world. And I've got it right there on the front page of Core Brain Journal on the lower left-hand, the lower left-hand corner. But How Not to Die is just a great book. I've actually got it on Audible, so I can listen to it when I'm, driving to work and really get and he's so engaging and so pleasant. But I was wondering if that may have been something that did happen to you, because one of the things he raises is the whole food thing as it relates to mental health. And I was thinking that may have been contributory to your wellness.
Well, I mean, it's contributory to my general wellness. In other words, that's my physical wellness, but my mental wellness, but the only cure for bipolar, because what bipolar is it's a state of mind like any other. Why does someone suffer? Why do people suffer? Is because they believe what their mind's telling them. That's why they're mentally ill, quote unquote. Mm-hmm. So why don't how did I liberate myself from mental suffering? I know myself beyond my thinking mind. And this, as far as I know, is the only permanent cure for bipolar disorder, because if I don't allow my mind to cause me suffering, I can't be bipolar anymore. But to know yourself beyond your mind, that the only way to do that, that I know how, was to take the inward journey. And, you know, this is, I don't know if you know who Eckhart Tolle is, or Sadhguru. I don't know if you follow, or even Buddha. Mm-hmm. We all have Buddha. We're all Buddhas. Every single human being is a Buddha. Now, how do we know that we're a Buddha? Because we all have our voice of consciousness. It catches up to us. Some people, it takes 2 days after they've done something. They say, wow, you know, there's something not right about that I've done. And that's our voice of consciousness. The more we listen to that voice of consciousness, the more Buddha we become, so to say. Mm-hmm. And what I did was I appointed that voice as my actual teacher. Now, the only way I was able to do that was through the Tao and through the extreme faith that I had within myself. But as I said before, I would not have surrendered the thought of who I was. Whoa. I had a jalapeno pepper before. it just hit the throat. But I wouldn't have surrendered the thought of who I was if not for the fact that I got to the point of suicide. I had no other choice to do that, and I went through states of depersonalization for months because I didn't know that. But this was the scariest thing, is because you know, I could laugh about it now, but you know, I was taught in medical school I'm not supposed to have another voice inside of me, so I was. And I didn't go back to the doctor. So this was very, if you can imagine how scary it was to live in this state for a long time.
Well, let me ask you a question.
But now I know that it's just my voice of conscious is the other voice, and every other human being has this voice within them, every single one of us.
If we just listen to it. Now, let me interrupt, because I was living with you for a moment in that trial identification we all have when you were talking about what was happening to you. And the shrink in me was thinking, depersonalized. Did you actually were you outside of your body? Did you depersonalize in that level? Or did you depersonalize in terms of your thoughts were watching yourself? How did that depersonalization take place so that we could appreciate that?
Yeah, I hope I'm using the right term. What I meant to say is, when I looked at myself in the mirror, I didn't know myself at all. Mm-hmm. It was like looking at a blank slate. Mm-hmm. I had no clue who I was, because when I gave up my name identity and my religion identity and every other thought of who I was, when I looked at myself, I didn't know myself anymore. Mm-hmm. It was like looking at a stranger. So I got very scared. And I didn't know what to do. So that's when I surrendered myself to this other voice. And then over time, it took me months to even have enough faith to leave this other voice and go back to the world again. And I had to kind of relearn Western society again from scratch, believe it or not, because when I was in my heart, so to say, I was so full of love that actually people didn't know what was going on. So I'd come up to people that they didn't know me, and I'd give them a big hug. And they'd look at me kind of strange, because it's not the Western thing to do, to just go up and like hug somebody. Mm-hmm. So I had to relearn everything once again, and that was the trick, because in the end, Western culture is just a learned behavior set. When it's, depending on where we're born, if I was born in Africa, then I would have learned another behavior set. I happen to be in the United States, and I went to medical school, and based on my upbringing in New York, this is the behavior set that I operate on. So I had to relearn that behavior set again.
Yeah, well, I think and what you're saying is, to exist in society, there are certain boundaries that people have as givens, and no matter how transformed you are, for you to be a messenger, to carry a message and to have that message heard, you have to be aware of those boundaries on the front end, or everyone will just move away anyway because they just won't understand what's going on.
Yeah, to communicate with other people within the culture, you have to be on the same belief and value system, at least, because of the general population, they, especially like in America, this is how we have this conversation today. You went to a school, I went to a school, we learned the English language, we have this in common, and so we can communicate. Now, if I go to Africa and I speak like this, and they don't speak English, they won't know what I'm talking about. Yeah. So it's basically, and this is why all human beings are the same in essence, because we're all born the same, and then depending on where we grow up and what we acquire in our minds, that has a large impact on how we go on to act as people throughout the day, so to say. It's really based a lot on what we learn in society.
So let me ask you a little bit of, can you give us a little bit of prelude to what's going to happen with your training? Are you going to be training individuals? Do you do personal consultation? Do you have are you developing a program? What's the nature of that situation?
Well, right now I'm trying to build an awareness that, of course, I know that I've cured myself of something deemed incurable, so I kind of want to put that out there. I have my website that has some teachings in it. So my goal is to teach people, not just on an individual basis. Of course, I'd more than welcome helping out anyone that I could, even as an individual, small groups, what have you. Anyone that's interested in knowing, I'd be more than happy to offer my expertise in this way. But it's just to kind of start teaching people, whether they be patients or anybody that's interested in finding out about themselves, in a way they might not know themselves, and we're all our greatest teachers. And so I would just like to serve almost as, I would give some pointers on these practices that I utilized on how I healed myself. One of them I shared with you, and this would be the message that I would be putting forth to people is the power of forgiving within ourselves, or the power of feeling things within ourselves without utilizing our minds. That these things, sure, science is great, and we can figure out a lot of stuff by studying things, but I think we have to bring back some of the more ancient ways, and this is coming back. People are meditating nowadays, and there's a lot to be said about being still and quieting our minds and really starting to feel the essence of who we are as human beings. These are the kind of things I want to start to, I guess, maybe bring a little bit of ancient flavor into a Western world that's going a bit too far in the deep end of science has the answer for everything, so to say.
Well, your wisdom is really right on, because it's. I think so many people are moving in that direction. I think they've been moving in the direction since the 60s. Actually, it's a slow but gradual turn. I remember reading long ago, and I'm reminded of the book Chop Wood, Carry Water, which you may or may not be familiar with, but
that's the Buddha.
Yeah, and I thought that you would, if you haven't read that book, you'd get a kick out of it, because it's so much about what you're talking about. So, how does a person who's in this recovery that you have, how does this person actually put food on the table? I mean, do you work in a 7-Eleven now, or what do you do?
It's funny. Well, I wrote my book, so I consider myself an author.
Mm-hmm.
I actually rewrote the entire language of mathematics, and that has not yet to come out. But I've so to say, disproven mathematics within the language of mathematics. Up until now, it's been a philosophical endeavor, but a lot of what I want to show is to show the limitations of mathematics, which is kind of like the root language of all of science. I've always been a mathematician. I've always been, that's been my side hobby, so to say.
Is that right? Oh. Well, I've got to recommend the book.
I'm a scientist, and I converted. This is why it's humorous, because it took this kind of trauma in my life to shake me up and prove to myself that there is something beyond the intellect, because my whole life I've been fascinated with quantum physics, mathematics. That's been like my daily bread.
Oh.
And so I spent months locked up in a room doing mathematics. That was part of my torture, so to say.
Yeah, well, part of the structure, because then you would have been putting pieces together. It would have been a very complex puzzle. I meant to mention this earlier, but because I remembered reading about your interest in physics and so on. I would just one of my favorite books that you may or may not be familiar with is Science and Sanity by Alfred Korzybski. Have you heard of that one?
No, I have not. But I'll look into that.
It's at the following link. I used to have it on the front page, but I took it off because I thought it was a little too deep for people who are just looking around. But it's at geni.us, genius, geni.us/science. And that'll take you right to the book. And the reason I'm saying that's a global Amazon link right there. So anybody that's listening to this, we have listeners all over the world. Anybody that's listening to that can pop in and look at Science and Sanity. And the reason I came to mind is because what Korzybski's talking about is labels, and he gets into mathematics and physics. And I know that you would be interested because that's just what you were talking about, and I neglected mentioning it earlier.
And the whole language of math is based upon a concept called one. And in fact, my book kind of explores that. But you see, math is kind of like a shorthand language, because, of course, it would be very tedious to write out 1 million, like in a cave. To put 1 million tick marks on a cave would take quite amount of time.
Mm-hmm.
So every single number that we write is shorthand to relative to 1. The whole language is built on that. So it's not like 5 has any unique. We don't write 5 relative to 1. We just write the number 5. It's assumed that it's relative to 1. So no number has any intrinsic meaning. It was a system that was built based upon the concept of 1, because if we based upon the concept of something called 5, then it would be 1/5, 2/5, 3/5, 4/5, 5/5, even pi. Pi is relative to 1, because pi relative to pi is 1, right? We could make another language relative to pi. We could say 1 over pi, 2 over pi. But what's the only number relative to pi that gives you back 1? Pi. And so it's interesting when you go through the language and why a language was created. You can find certain little loopholes that are kind of taken for granted, because we learn math when we're such young people that we just accept these things as truths. But when we examine how they came about in the first place, we discover that there's more than meets the eye, so to say.
Yeah, you'll love Korzybski. That's just what he's talking about. And and he actually takes some of the curves. I mean, you're obviously strong in math, and that's not my strong suit by any means. But he was talking about calculus and how it works out in the way of being inaccurate based on what you're talking about. It's too reductionistic and doesn't cover all the bases properly. Thanks for listening to Core Brain Journal. We're working every day behind the scenes to bring you reports that connect research benches with those street trenches. Here we share the complexity of mind science because, as you know, details really do matter. One of the most pervasive, misunderstood challenges is how commonplace medications, like those written for ADHD, are used so regularly without clear guidelines. If you think you'd like more specifics, take a minute to download my 2-page PDF packed with video links and references on the absolute essentials of how to start ADHD medications. They're easily available at corebrainjournal.com/start. Thanks for listening. Do connect and stay tuned. Together we can make a difference.